Hello students, we usually hear that it is the responsibility of the government to provide quality healthcare services to all its citizens. It is important to work on public health facilities as on basic amenities in order to improve the health situation of people. But how government does so? The answer to this question shall be discovered in today's lesson, which is named as Role of the Government in Health. To understand today's lecture, we need to understand what exactly health is. Health means our ability to remain free of illness and injuries. Okay, so is this criteria enough to define a person as healthy? Obviously not. We need to consider other examples too. A person getting clean water or an environment which does not have pollution is more likely to stay healthy, but the person who is not able to get proper amount of food or is not having basic facilities has more chance of falling ill, which in other words means that he is more prone to diseases. Also, we usually ignore the concept of mental health. Mental health plays a vital role in a person's life. It is not healthy to be dull, worried, or scared for very long. For example, if I talk about a person who is worried and scared all the time, will he be able to live a healthy life? Or will he able to enjoy his life? Obviously not. So, for a person, all these factors are important to be regarded as healthy. Now let us move to the second part of the lecture, which is healthcare in India. This table clearly describes the situation of healthcare facilities of India. Left column shows how the medical facilities have improved, whereas right column shows that non-accessibility of these facilities to majority of people. This table states that India among largest producer of doctors, but most of the doctors are settled in urban areas, which makes it hard for the rural people to reach them for treatment. Also, healthcare facilities have grown at a very fast rate, and India gets a large number of medical tourists, which means people from the countries come to India for the treatment. Moreover, India is the third largest producer of medicines in the world. But when it comes to the other side, we still have some drawbacks. Major among these are about 5 lakh people die from TB. Almost 2 million cases of malaria are reported every year. Clean drinking water is not available to everyone. 21% of all communicable diseases are waterborne. Communicable diseases means a disease that can be transferred from one person to other. Half of the children in India are undernourished, which means they do not get a proper amount of food. This is something opposite to what we expect. So, what can we do to make condition better? In order to prevent and treat illnesses, we need appropriate healthcare facilities like ambulance, blood banks, hospitals, etc. Good health workers, nurses, qualified doctors. We all need the medicines and equipments. Our country has the money, knowledge, and people with experience, but cannot make the necessary healthcare available to all. In the next segment, we will look at some of the reasons for this.